Assalamu alaikum dear students. This is the last lecture in the strategy, the menstrual cycle. What we will discuss in the menstrual cycle, we will discuss the stages and phases of the menstrual cycle as well as which hormones they are required at which phase. So we will discuss them in detail. As well as we will also discuss some abnormalities related to the menstrual cycle of the women. A menstrual cycle is a combined name for the two cycles which are occurring simultaneously at the two different sites at the ovary and at the uterus. The cyclic changes which occur in the ovary, that is known as the ovarian cycle, which we have discussed in the previous lecture. On the other hand, there are some cyclic rhythmic changes in the endometrium of the uterus, and that cycle is actually known as the uterine cycle. So, because they are occurring in the uterus, that's why they are known as the uterine cycle and the ovarian cycle. These both cycles they are combined known as the menstrual cycle. So, as हमने यूट्राइन साइकिल ये हमने प्रीवियसली डिस्कस किया था, तो हम यहाँ पे सेम पर यूट्राइन साइकिल की बात करेंगे. तो जैसे अभी हमने प्रीवियस स्लाइड में कहा कि यूट्राइन साइकिल जो है ये जो म्यूकस मेम्ब्रेन है इनसाइड ऑफ द यूट्रस के इंटरनल वॉल जो है व्हिच इज endometrium and it is internally present, that's why it's known as the endometrium. तो इस endometrium में कुछ changes होती हैं और वो changes rhythmic and cyclic changes होते हैं in response of the estrogen and progesterone. तो ये जो changes in response of estrogen and progesterone होते हैं तमाम rhythmic changes को menstrual cycle कहते हैं और इसकी जो duration range है minimum that may be 3 weeks or 20 days and maximum time have reached up to 5 days, but the average it is the 28 days. आने वाले लेक्चर्स में स्लाइड्स में हम इसी लेक्चर में हम डिफरेंट फेजेस की जब हम डिस्कशन करेंगे तो हम इस एवरेज 28 डेज को ही द टोटल ड्यूरेशन द पीरियड ऑफ द साइकिल ही हम लें. There are three phases of the menstrual cycle: the proliferative phase, the secretory phase, and the menstruation phase. अब प्रोलिफरेटिव फेज को पोस्ट मेंस्ट्रुअल भी कहते हैं क्योंकि जब मेंस्ट्रुएशन हो जाती है तो मेंस्ट्रुएशन के बाद जो नेक्स्ट फेज है दिस इज द प्रोलिफरेटिव, दैट्स व्हाई इट इज नोन एज द पोस्ट मेंस्ट्रुअल फेज. इस फेज में जो हार्मोन दैट इज रिक्वायर्ड और इसकी जरूरत होती है उसके बगैर ये प्रोलिफरेशन जो है ये नहीं होगी. तो इस योग एस्ट्रोजन होता है और ये वही एस्ट्रोजन है ओवरियन साइकिल में थी के इंटरना से रिलीज ग्रेनुलोसा सेल जो है वो रिलीज करते हैं. तो वही एस्ट्रोजन जो है जो ओवरी में रिलीज हो रही थी दे विल एक्ट ऑन द एंडोमेट्रियम ऑफ द दैट यूट्रस. अब प्रोलिफरेटिव इसको क्यों कहते हैं क्योंकि यहाँ पे प्रोलिफरेशन होती है एंड व्हाट वी मीन बाय द प्रोलिफरेशन दैट सिंपल मीन the increase in the number of cells through the mitosis is simply known as the proliferation. यहाँ पे दूसरा फेज जो है ये सिक्रेटेड फेज है. आप सिक्रेटेड फेज को क्यों कहते हैं क्योंकि यहाँ पे न्यू ब्लड वेसल्स बनते हैं, यहाँ पे ब्लड सप्लाई ज्यादा हो जाती है, रिच ब्लड सप्लाई आ जाती है और बाकी सिक्रीशन भी जो है यहाँ पे ज्यादा हो जाती है. दैट्स व्हाई इट इज नोन एज द सिक्रेटेड फेज. क्योंकि ये फेज जो है जस्ट मेंस्ट्रुएशन से पहले होता है यानी इसके बाद यानी सिक्रेटेड फेज के बाद फिर मेंस्ट्रुएशन फेज होगा. That's why it is known as the pre-menstrual menstrual phase, yani the phase which is just earlier to the menstruation. The hormone which is required for the secretory phase is the progesterone, and that's why it is known as the progesterone phase. ये वही प्रोजेस्टेरोन है जो ओवरियन साइकिल में कार्पस ल्यूटेम जो है सीक्रेट कर रही थी फ्रॉम दैट after the ovulation till the 21 days जो progesterone secretion थी that secret body will secrete the effect upon hair in the uterus and will lead toward the secret phase. Now if there is no pregnancy, there is no fertilization of the male female, so there will be the menstruation phase, and if there will be if there is fertilization, there is a good formation fertilization of the male and female, so then there will be no further menstruation for the upcoming month, and this was the changes which have been present there in the proliferation and the secretion which have been made there in the endometrium. They will there and just to enhance the fertilized egg. The fertilization basically occur normally in the fallopian tube. And after fertilization, the fertilized ova they will then move towards the uterus where it will be enhanced in the endometrium. Some detail of these stages, the proliferative phase. In the first half of the menstrual cycle, the estrogen that cause rapid increase in rapid proliferation of the stromal cells and the epithelial cells. And because of this rapid proliferation, there is thickness of the same endometrium. The endometrium which जो इससे जो कि ये तो पोस्ट मेंस्ट्रुअल फेज होता है तो इससे पहले जो मेंस्ट्रुएशन हुई थी उसमें पहले साइकिल का जो स्ट्रोमल और एपिथेलियल सेल की जो रैपिड प्रोलिफरेशन हुई थी वो सारे के सारे तो वो श्रेड हो गए थे सो ये जो डिस्क्रिमिनेशन हुई थी प्रीवियस मेंस्ट्रुएशन में ये दोबारा बिल्डअप हो जाती है दोबारा उसकी रीपिटलाइजेशन हो जाती है द एपिथेलियल सेल्स व्हिच वर destroyed and which were shredded and which were just released in that menstrual fluid that will again build up in the next 3 to 7 days. So इसकी वजह से जो ये proliferation की वजह से स्टोमा और एपिथेलियल सेल की जो डिवीजन होती है इनकी नंबर इंक्रीज होने से the thickness of the endometrium they will increase up to the 3 to 5 millimeter. और वहाँ पे जो एंडोमेट्रिक ग्लैंड्स हैं वेसल्स है इसकी भी जो है इनलार्जमेंट होगी वहाँ पे उनकी नंबर जो है ये भी इंक्रीज हो जाएगी so we can see here this is actually uh, the previous era जो ऑलरेडी प्रोलिफरेशन हुई थी यहाँ पे मेंस्ट्रुएशन हो जाती है उसके बाद ये जो साइकिल है यानी ऑलरेडी ये जो एक्स्ट्रा एपिथेलियम है ये डिस्क्रिमाइजेशन हो जाती है इसकी ये रीविटलाइजेशन शुरू होती है एंड दैट इज एक्चुअली द स्ट्रोमल एंड एपिथेलियल सेल्स यहाँ पे मेच्योर ग्राफिकल से जो स्ट्रो वहाँ पे granulosa cells and tinga interna the ovarian cycle when they will just release the estrogen and that estrogen will work on the endometrium of the uterus. This is the internal wall of the uterus. As we can see here, there is gradual increase in the thickness of this wall as we uh, move towards the base and towards the proliferative that is the peak thickness of this proliferative phase. So there is not only the increase in the number in the stromal and epithelial cell, there is also increase in the glands and the blood vessels which are present there. This is actually the ovarian cycle. This was the primary cycle. The primary site that is then being converted into the secondary site, secondary into the tertiary, tertiary into the vesicular, and vesicular then into the chair, follicle जहाँ पे interim complete हो जाते हैं फिर after period almost 14 day पे यहाँ पे OI is released into the peritoneum and the remaining structures the theca interna the and as well as the other granulosa cells, they will just convert into the corpus luteum, which is a yellow body, and that will release the progesterone up to 1 week almost, and after 21 days, they will shrink and decrease in size and will convert to another structure known as the corpus albicans, and the corpus albicans stride and secrete. So that was the ovarian cycle. In the uterine cycle, the events occurring that is the first phase, the proliferative phase, and then this is the secretory phase. We can see here the difference in these two areas. There are enlargement and not only of the blood vessels, but there is more blood vessels here. There is more secretion here. The glands which have been increasing the proliferative phase, they are now in the peak secretion and that is why this phase is known as the secretory phase. Now the hormone required for this increase in secretion that is the progesterone. So and that progesterone which is secreted by the that corpus luteum. So it means the ovarian cycle and the uterine cycle they both are occurring in a rhythm simultaneously at the same time. And here the estrogen is released and this is being used and here the progesterone is being produced and it is used here. And if there is at the end, if there is pregnancy is positive, if there is a fertilization of the male and female gamete, if zygote is being formed in the fallopian tube, so there will be no more discrimination and no more shredding of the epithelium for the upcoming month. And if there is no such fertilization of the male and female gamete, so these all changes which have been made in the proliferative phase as well as the secretive phase, they all will be destroyed in the next phase known as the menstrual phase. And in the next cycle again, there will be through the help of estrogen, there will be increase in the thickness of the endometrium cell through the proliferation, through the increase in the stromal and epithelial cells. And there will be again increase in the stromal, increase in the blood vessels, increase in the glands, increase in the secretion, and the cycle will repeat itself. That is the reason the this uterine cycle that is known as a rhythmic cycle, that is also known as a cyclic, because there is repetition of this cycle again and again with the same event, with the same sequence until if there is no such abnormality. The abnormality may be the absence or the lacking or there is the inadequacy of some of the hormones, specifically the estrogen and the progesterone, and that may be primarily, there may be secondary, but in both cases there may be increase or decrease in the uh, duration of this phase. If it is less than 20 days, again that is too short and there is a dominant, and if it is more than 45 days, again it is considered as too long and that is again an abnormality. Otherwise, the normal duration, the average duration for this both ovarian cycle and the uterine cycle, this is 28 days. And these both cycles, the ovarian cycle and uterine cycle, which are occurring in the ovary and uterus respectively, they are commonly known as the menstrual cycle. You can see here, we can see the venous lacunae, the intermenstrual vein, the spiral artery, the basal artery, the carotid artery. They have been enlarged, the diameter increased, they are dilated, they are filled with blood, they are filled with other secretion, and all these are being destroyed and shredded in the next phase, which is known as the menstrual phase, which is very short duration, just 3 to 4 days. And that's why the secretive phase is just earlier, just before the menstruation. That's why it is known as the pre-menstrual cycle. These are the graph which show the requirement of the two hormones. We can see the blue line is representing the estrogen, while the red line, the orange line, that is representing the progesterone. And we can see the two peaks. One peak is in the initial when there is build up and increase in the build up the endometrium, where we can see a large increase in the estrogen that is being made from the graphic follicle. This is the mid of the ovarian cycle where there is ovulation, the egg is being released, and hence there is increase in the progesterone, but not at that level. After the ovulation, there is change in the scenario. The estrogen is being reduced abruptly, and at the same time, there is sudden increase in the progesterone. So there are two peaks in that when there is increase in the secretion, the progesterone is required, and when there is increase in the width and length of the width and thickness of this endometrium, the estrogen is required. As we have discussed in the secretory phase, the second half of the menstrual cycle, there is marked swelling and secretory development of the endometrium. The glands become tortuous. Tortuous, that simply means they are not, they become loose and they are not straight. And this is actually because they are filled with blood and they are filled with the fluid, and that's why the glands should be tortuous for this function. Secretory substances accumulate in glandular epithelium, cytoplasm, glycogen increase in stromal cell, blood vessels increase and become tortuous like the gland, and endometrium increase in thickness further in 5 to 6 minutes. Now, why there is they are tortuous? Just because they are storing more blood and more fluid in their cell, and that's why they become the tortuous. The menstruation phase, during this phase, all the superficial layers of the endometrium and are discriminated through the vagina. And if there is pregnancy, if there is fertilization of the male and female gamete, so there will be no such discrimination of these endometrium. And this thickness and this secretion, which is being increased, obviously they will remain for the upcoming months. The causes of menstruation, the cessation of the estrogen and progesterone secretion 2 days before menstruation, as they both are ceased, their secretion is stopped, and that's why the lacking of these two uh, hormone they will lead to the menstruation. As we have discussed in the ovarian cycle, if there is pregnancy is positive, there is fertilization, then there is continuation of the corpus luteum for 3 to 4 months to secrete progesterone. यानी वहां पे अगर फर्टिलाइजेशन नहीं हुई है तो कार्पस ल्यूटियम जो है ये 21 डे आप द ओवरियन साइकिल तक सिर्फ प्रोजेस्टेरोन सिक्रेट करेगा और उसके बाद उसकी साइज श्रिंकिंग हो जाएगी और उसकी जो कैपेसिटी ऑफ रिलीजिंग द प्रोजेस्टेरोन रिलीज बंद हो जाएगी जिसकी वजह से जो है ये प्रोजेस्टेरोन बंद हो जाएगा एंड दे विल बी मेंस्ट्रुएशन लेकिन फर्टिलाइजेशन में होता क्या है कि कार्पस ल्यूटियम जो है इसकी साइज श्रिंकिंग शुरू नहीं होती और ये इसी तरह एक हफ्ते के बजाय तकरीबन 3 से 4 महीने तक ये कार्पस ल्यूटियम रहती है इन द ovary and there it secrete the progesterone and this progesterone is required for the initial months of pregnancy and that is the reason why the progesterone is sometimes also known as the hormone of pregnancy. So this is actually another image showing the both uterine cycle and the ovarian cycle. You can see here they can be divided into different phases. This is the menstrual fluid, which is normally 70 ml. There may be increase and decrease in this. This is the average fluid. The characteristic of this fluid is that this fluid that does not clot due to the presence of the fibrinolysin, and because of this substances, there is no clotting of the menstrual blood. Now, some terminology related to these conditions, the menopause and other. So, what we mean by the menopause, this is the cessation of the menstruation in old age is called the menopause, and it's caused by the lacking of the sex hormones, specifically the estrogen. Age is almost 5 years, and what are the symptoms of this menopause? In that include the heart, the psychic sensation of the dyspnea, the irritability by the that by the, uh, fatigue and anxiety and depression in that patient. What is amenorrhea? Amenorrhea it means the cessation of the menstruation in any stage. That is we have talked about the menopause कि ये सिर्फ 45 और 50 साल की दौरान होती है और ये एक नेचुरल फिनोमेना होता है एक एजिंग के साथ होती है कि वहां पर जो स्पेसिफिकली एस्ट्रोजन वगैरह की न होने की वजह से ये मेनोपॉज यानी मेंस्ट्रुएशन बंद हो जाती है लेकिन ऑन द अदर हैंड यहाँ पे बिकॉज ऑफ सम इन रीजन किसी भी एज पे अगर मेंस्ट्रुएशन जो है ये बंद हो जाती है सो दैट इज विदाउट द प्रेगनेंसी so that is regarded as the amenorrhea. There are two types, the false amenorrhea and the true amenorrhea. The false amenorrhea जिसको sometimes cryptomenoria भी कहा जा सकता है, hidden menstruation भी कहा जाता है और इस menstruation में यहाँ पे menstruation होती है but the patient is unaware of it and because outflow वहाँ पे block हो जाती है that may be blocked at the level of cervix, at the level of vagina or level of the vulva तो किसी भी वजह से if the blockage to that fluid it is been blocked so there is menstruation हो जाती है blood is being released but actually because of the blocking there is no oozing out of the blood so the patient just sense that there is no menstruation so that's why that is known as the hidden menstruation or the cryptomenoria. The true amenorrhea, and this is a pathological condition when the menstrual function is being suspended, so there is no menstrual fluid, there is no blockage, and this is actually amenorrhea. What is the dysmenorrhea? Dysmenorrhea means any type of pain during the menstruation in that area, specifically the pelvic area, and just the pain is present during the menstruation. This condition is known as the dysmenorrhea. So that discomfort during the menstruation is called the dysmenorrhea. Uh, there are many causes of dysmenorrhea. They may be pathological, they may be psychological as well. And usually, the location, the site of the pain in the dysmenorrhea is in the pelvis, but they may also be present in the lower parts of the abdomen. Sometimes the main cause, the common cause for the dysmenorrhea is actually the lacking of the enzyme fibrinolysin, and that's why there is formation of the clot in the blood. Usually, the fibrinolysin is present in the menstrual fluid in the menstrual blood, and that's why they lack to be clot. But as if this fibrinolysin is absent, so this absence will lead to the production and the formation of the clot, and that clots when they are passing through the vaginal pathway, they will lead to the pain, and which the condition is known as the dysmenorrhea. There is another condition which is associated with the menstruation. This is known as the polymenorrhea, and that is when there is too much menstruation, and abnormal frequent menstruation is known as the polymenorrhea. Polymenorrhea is the medical term for cycle with interval of 21 days or 20 days or between. The minimum duration for the polymenorrhea is 20 or 21 days, and if the duration of this menstrual cycle is less than 20 days or 21 days, so then it will be called as the polymenorrhea. That was the end of today's session. We discussed the menstrual cycle, we discussed the hormones which are required at the different phases of the menstrual cycle, and then we also discussed some immunities which were associated with the menstruation. That were a brief introductory type. We didn't go into the detail in this session. Actually, we will discuss them and some other things. Thank you so much for having a nice day. I love you.